Okay, so now we're going to cover the muscles on the leg. The biggest muscle on the posterior end is what we know as the gastrocnemius. It has two bellies right over here. It inserts in, or it actually originates in the femoral condyle, and it will insert in the calcaneus via this calcaneal tendon right over here. Now, the calcaneal tendon is also formed by the fusion of the tendon that's coming from the soleus, which is located right over here underneath the gastrocnemius. So the soleus is going to originate on the head of the fibula and also on the posterior medial shaft of the tibia. And again, it's going to form the calcaneal tendon together with the gastrocnemius. Now, function of the gastrocnemius is to plantar flexion at the ankle and also flexion at the knee. And the soleus is plantar flexion at the ankle, but then it also serves as like a postural muscle when you're standing. For us to see the next muscle, which is the Popliteus, we have to remove the gastrocnemius and the soleus. So we have right over here what we know as the Popliteus. The Popliteus is going to originate on the lateral condyle of the femur. It's going to insert on the posterior surface of the tibial shaft, and it's going to cause medial rotation of the tibia or lateral rotation of the femur at the knee, and also it's going to cause flexion at the knee. Now, the plantaris is a muscle that, like the name says, it's going to go to your plantar. So if you look right over here, it has a really long tendon that will go all the way to the plantar. So it originates right over here. You can see a little bit of it right over there. So it originates on the lateral it's called supracondylar ridge of the femur. So, but on the lateral side, that's what's important for you to remember. And it's going to insert on the posterior portion of the calcaneus. So you can see how it comes all the way, like the long tendon comes all the way down over here, and it's going to insert over here on the calcaneus. And what it does is it doesn't do much. It does a little bit of plantar flexion at the ankle and flexion at the knee, but it's really known as proprioceptor. So it's going to tell you where you are in time and space. The next muscle is this tiny little muscle that we can see over here. This is the tibialis posterior, like the name says. So you can see it's a little bit more medial, and it's on the posterior side, so it's called tibialis posterior. So it's going to originate in the interosseous membrane and adjacent shafts of the tibia and fibula, and it's going to insert in the navicular and all three cuneiforms, the cuboid and metatarsals 2, 3, and 4. In terms of action, it's going to cause inversion of the foot and plantar flexion at the ankle. The next muscle is the muscle right underneath it, which is the flexor pollicis longus. So like the name says, flexor means it's going to flex. Pollicis means that it's going to flex your big toe. So flexor pollicis longus. It's going to originate in the posterior surface of the fibula, and it's going to insert in the inferior surface and distal phalanx of your hallux. And like I said, it's going to cause flexion at the joints of the hallux, so your big toe, and it's also going to cause plantar flexion of the ankle. Now we have what we call the extensor retinaculum of the foot. So if it's extensor on the foot, means that it's on the anterior side. So we have right over here the extensor retinaculum of the foot. So you can see all these tendons are going to sort of be secure by this collagenous tissue right over here. Right over here we have the Flexor Digitorum longus. So like the name says, flexor means that it's going to flex. Digitorum means that it's going to flex the digits. Longus means that it's long. So it's going to originate in the posterior medial surface of the tibia and insert on the inferior surfaces of the phalanges, more specifically 2 through 5. And like the name says, it's going to flex the toes 2 through 5, and it's also going to cause plantar flexion at the ankle. The last one, since we have a Flexor Digitorum longus, we also have a Flexor Digitorum brevis, which is this 49 right over here. It's going to originate on the calcaneus, and it's going to insert on the sides of the middle phalanges 2 through 5. And therefore it's going to cause flexion of the proximal interphalangeal joints of toes 2 through 5.